You're here to learn a little bit about what we do. We focus on one single procedure, which is the gastric sleeve. It is a type of weight loss surgery. It is the most popular surgery now in the United States for 2 years in a row. 2016 and 2017 surpassed any other weight loss surgery procedure out there, including gastric bypass and not to mention the gastric band. Why do I focus only on this procedure? Because I have total belief that this is the best procedure out there. It is the least invasive and will give you the best outcome without messing up your life, giving you not good quality of life, better quality of life. And I placed my bet on this procedure about 12 years ago, yeah. And I wrote the first book on the gastric sleeve 2010, so that's 8 years ago. 2010, there was nothing out there. I mean, now with the internet and Google, I mean, you just throw it out there, social media, you'll get something out. But you would type in gastric sleeve, there's nothing at all. So I said, well, I'll write a book focused on instructing patients, giving tips and how to go with this procedure and what to expect from it. That was back in 2010. We've done several editions now. Now we've got 6 books out. And I placed my bet on this procedure because it is an amazing procedure. It gives you really, really good quality of life without looking into the side effects other procedures do have. So let's start with why, all right? So why would you decide to do this? To get into an invasive procedure and take a risk into going into surgery? Well, the reason is it is very well known that this procedure will give you years of life, will add years to your life. It is well known statistically and studies, and will give you quality of life, which was mentioned a few minutes ago. So it's not just me saying it. We've got all the media on it. This is from the ASMBS, which is the maximum authority on weight loss surgery in the United States, where weight loss surgery is the most effective, long-lasting treatment for obesity and will help you with type 2 diabetes, high blood pressure, triglycerides, cholesterol, so on and so forth. And of course, that got popular, and now everybody's putting their eye on weight loss surgery. Reduces risk of death, better quality of life, increases life, reduces cancer and diabetes, and all these good benefits. And of course now, the term metabolic surgery. And the term metabolic surgery goes towards a combination of stuff going on with you, including diabetes, high blood pressure, sleep apnea, high cholesterol, and as a global, it's called a metabolic syndrome. And that is what kills us, all right? So it's a time bomb. Of course, once we reduce the weight, everything gets so much better, and of course your body thanks you, and it will live longer. This is also from the ASMBS, and this is all the proven and shown benefits of weight loss surgery and their statistics. There are a lot of percentages here, 80% resolved in metabolic syndrome, diabetes, fatty liver, migraines reduced 60%, so on and so forth. But the most important ones are down here. Quality of life improved in 95% of the patients, and the mortality is reduced in 89% of the patients. So that is the goal. That is why take the step. You want to live longer and you want to live better. But yeah, doctor, but this thing is dangerous. People die here. People may go under certain risks that why take them? Well, the thing is, nowadays, these procedures, I perform a sleeve in about 25 minutes with my team. Last year, I was flown over to Brazil to perform a sleeve without my team. I flew solo. Holy smokes. Damn. They were transmitting live this surgery. I was like, damn, I hope they don't understand me. And I don't speak Portuguese, but yeah, it's the team. It's the whole team that I have people working inside the operating room since day one, since 2006. They read my mind, I read theirs, and it's my team in combination that craft the perfect recipe again and again. So, truth is, I mean, there are risks of just being here. I mean, you have a risk of being here. I mean, if this theater just goes on fire, we have a risk. If you cross the street, there's a risk. I mean, but the truth is, for patients who are obese and suffer from weight issues, they have a higher risk just staying the way they are and actually taking the step up front and saying, I want to do this. I want to get healthier. Because it is a controlled risk. Going into our operating room is a controlled risk. We have everything set up. We've got every personnel. It's like being a captain on a plane, you know. If you fly from Memphis to New York City through American or United or whatever, I mean, they are running checklists all over, checking the plane, checking the maintenance, checking everything. And what's the possibility you arrive to New York City through American? Well, you're going to get there, most probably, right? Are there any risks getting on that plane? Well, hell yeah, you're 30,000 feet above the ground, right? So there is a risk, but it's a controlled risk. It's the same thing here. So it is something that we do. Something I totally believe in is doing it again and again and again and focusing on one thing, you know? Whoever follows me on Instagram saw that I was in Dubai a couple of weeks ago at the World Congress on Weight Loss Surgery, and I got to speak to one of the captains flying the Airbus A380, which is the biggest plane in the world. You know, it's a huge it's got 2 stories, and it's got showers, it's got a spa, it's got a bar in there. You know, it's a crazy plane. And I was talking to one of these gentlemen, and I was telling him, well, how many of you guys fly this plane? It's like 6 of us. So we've got 6 people flying the plane. I get tired. It's a 17-hour flight. All right, 17 hours in the air. I get tired. I turn it over to the next guy. He gets tired. We take shifts, flying and checking the plane out. And I told him, do you fly any other planes? He goes, I know how to fly them, but I just focus on this plane. So my training is focused on this plane only. Eases my mind, you know. That's what I do. I can do a bypass, I can do a gastric band, I can do any other type of weight loss surgery. I focus on this procedure. You know, being an expert, those 10,000 hours of flight, I mean, they do make a difference. It's a special technique. It's special safety for the patient. You know where the pitfalls are. You know what to avoid, how to manage it, and to have a good outcome. So it's the same thing here. And this procedure, you have several names. They've given it throughout the years. And this procedure is a very simple procedure. What we do is practically reduce, I like to call it, we reduce the gas tank. That's it. All right? We don't do anything else, just remove this portion of the stomach. But doctor, I was born with that part of the stomach. Maybe I need it down the road. Maybe it's there for a reason. Well, yeah, it's there for a reason. When we were cavemen, I mean, we really needed to eat and eat. If we had a chance to hunt a deer or a hog or whatever, and we would literally pig out, eat as much as we could, and enjoy, because we didn't know if we were able to hunt the next day or the following or 2 and 3 days. We had to eat. We have that same stomach as the caveman, 2018. The difference is, in 2018, we've got food in every corner. 7-Eleven, McDonald's, fast food. I mean, in 2018, you will not starve. As a caveman, maybe. So nowadays, this would be, I like to call it a 2018 model. We don't do anything else, just reduce the gas tank. So if you notice, the entrance of the stomach stays the same. It's the one you're born with. The exit of the stomach, if I see this indentation right here, that's the pyloric valve. Very important on digestion. That stays with you. You were born that way. God had a hard time creating this natural intelligent valve. Why remove it? Like with a gastric bypass, that's gone. You know? And of course the intestine is untouched. So that helps with you maintaining absorption 100%, avoiding malnutrition, malnourishment, protein deficiency, and some other aspects that come with gastric bypass surgery. By the way, if you guys have any questions at any point, please stop me and we can go over it, all right? I really want to throw this mic at you. I really do. Okie doke, so the idea is for you to have a maybe 4 to 6 ounce stomach in capacity. Not everybody gets 4 to 6 ounces before you force me to throw that mic at you. Let me tell you why. Because as you just saw a few minutes ago, everybody's weight loss is different because we are all different, and inside our stomach sizes are different. So when we go in, normally men have slightly longer stomachs than women. Men normally have a more, women like to call it like a not fair stomach because women have a little bit more restriction than men. But listen, it is adapted and it's to each and one of your beings. Men have more muscle. Men need a little extra capacity. And as you've seen, men can lose 100, 140, 160 pounds and do really good. So can women. So it's crafted to your needs, and it is a percentage. The reason we can't say a certain, my stomach is 4 ounces, my stomach is 5 ounces, my stomach is 8 ounces or whatever, it's because every stomach is different, and there is an exit here, there is a valve, because I get the emails, all right? Doctor, I ate 4 ounces or I ate 8 ounces and what's going on? I thought it was going to be smaller. Well, the thing is, this thing has an exit, you know? If you eat 8 ounces, it'll start dripping out, you know? So you really can't measure. So who's heard about these? It just freaks me out with the online stuff I see sometimes, the pouch test and the 5-day reset pouch thing and all these things, right? Well, the thing is, you can't reset it. It can't be done. I mean, it's like, there's this thing online. They call it the 5-day pouch reset thing, you know? And I see it on boards. I see it on weight loss pages and all that. And the idea is for this thing, the sleeve, to have a reset like a computer, to reset it to its original restriction point. Well, the thing is, when you get your procedure, when you get your surgery, it's swollen, all right? If I punch you right now, it'll be swollen. For how long? Maybe 7 days, maybe 10 days, maybe 14 days, maybe a month. That time will be the maximum point of restriction. Why? Because it's swollen, all right? That swollen tissue, you can't reset it. All right? As the weeks and months progress, the swollen tissue comes down and you'll get the final result, which is your capacity. You won't be able to get that back because it was swollen. It was not really your capacity from the get-go. So those things don't exist because there's an exit to the stomach. So the food you eat, while it's being digested, it's going out. Now, if we had a magic wand to actually close this thing up, then you can do a really good test and say how much capacity you really have. It doesn't exist. So I was telling you a few minutes ago, we are a team, and these are just a few of the doctors. We are a team of 6 doctors. I do the driving in each and one of the cases, because when people go into our new hospital and see all these doctors going in, it's like the first thing they go is like, wait a minute. but who's doing my surgery? I go, I am. I'm doing the driving. I do the driving every single case. Of course, I can't do the driving with all this help I was mentioning that I've really missed in Rio de Janeiro last year. But these gentlemen are been working with me for years now. We've done close to 15,000 cases already from around the world. And what we focus on is pretty much medical tourism. So patients that come from other parts of the world, mainly from the United States and Canada, where this procedure may be 15 grand, 20 grand, 25 grand, 30 grand, 40 grand, and it will cost you a fraction with exactly or even more technology and safety than done home. That's our goal. All right. Remember this one, Nina? Yeah. See if I can get it going. So Nina, I want to explain a little bit of what this is.
Yeah. So I had my surgery in
Wait. I got this. I had to. No, let's go slow. Let's go slow. Who can catch it? Here you go. There you go. Get it close, otherwise I'll hit someone.
This is pretty
Yeah.
cool. Can you hear me?
Yeah,
Whoa,
it works good.
Look at that.
That's pretty
wow. So that's my son there on the left. I had my surgery in 2014, and I did not tell anybody. So, in fact, I didn't tell him. I didn't tell my mother. To this day, my mother doesn't know. She just thinks I got thin.
Diet and exercise?
Yeah, that and exercise, yeah. So 1 year after I had my surgery, my son Tyler came. Now, Tyler was a ballroom dance instructor. Does he look like a ballroom dance instructor by that time? No. So this is 1 day after surgery, and he's teaching the salsa to his sleeve sisters.
Yeah, exactly.
So that's what it is.
So 24 hours after surgery. Thank you, Nina. Sorry. See if I can click on this. Is it working? Awesome.
By the way, he's lost 100 pounds.
Look at him go. 24 hours after surgery. He's a good instructor. Yeah. By the way, if you want to look at the whole video, salsaaftersurgery.com. I'll take you to the video, all right? So how do we do this? How can we make recovery so fast, quick, is by minimally invasive surgery, laparoscopic surgery, also known as keyhole surgery. And we do this with 5 tiny incisions. These incisions are placed more or less in this area right here. And they're shown big here as the cornflakes, all right? Shown to, how does it say? To show texture or something like that on the cornflakes, on the boxes. So they're big here for you to see, but the truth is the measurement is in millimeters, so they're very, very small. This is a patient of mine who's 8 months post-op, and you can barely see a little thin line here, another one here. But the scarring is minimal, but it really doesn't matter. The really good advantage here is the recovery. The recovery. Patients are getting out of bed 2-3 hours after surgery. They are walking the hallways that same afternoon, evening. And my local patients get discharged in less than 24 hours. So out-of-town patients, I ask you guys to stay 2 nights with me, just for security, just to make sure you're good, make sure everything's good, safety. And I check on you personally, make sure everything's good prior to going home. So I need to make sure you go home in one piece and everything is good. That is why I ask my patients to stay 2 nights. Now our new building, our new hospital has a complete hotel included. So I'll show you a little bit about what we do now with our new facility. And patients stay 1 night in the hospital floor, and just to change the scenario, the following day we switch them over to the hotel. All right, so patients, it gives you different aspects psychologically. You're not in a hospital room, Patients, we've seen it. They ask for medication way less. Patients feel better. They're walking. We have a park inside our premises. So we call it Endo Park. You've probably seen it on my Instagram. And we just placed, we ordered a big, huge 18-wheeler trailer packed with grass, and we just finished the park this week. So yeah, patients recover really, really quick. Now, Dr. A, why should I do this procedure you're telling me, and maybe why not the gastric bypass, or why not the gastric band? Well, because they have a lot of problems down the road that the gastric sleeve doesn't. I tell patients, once you get a gastric bypass or a gastric band, that is the day your troubles begin. Once you get a gastric sleeve, that is the day your problems get resolved. Why? Because a gastric sleeve is a maintenance-free procedure. It does not need adjustments. It does not have a foreign body inside. You don't need any needles being stuck into you to see how your band is or anything like that. You don't have any malnutrition, malnourishment like the gastric bypass. You don't need any labs like the gastric bypass every 3 to 4 weeks or 3 to 4 months, depending on the case. There's no risk of internal hernias like the gastric bypass. There's no risk of ulcers, marginal ulcers like the gastric bypass. There's no risk. And I can go on and on and on with all these procedures that have a certain type of risk down the road. Not with the sleeve, you know. That is why. Now, who's a candidate? Not everybody's a candidate. Not everybody can get weight loss surgery. A few years back, I had this patient come in for a consultation and walks into my office. She was sitting down, and I didn't know what the hell was going on. She was thin. She looked like a model, thin. She was actually a ballet dancer. And I'm looking at her. I go, hi. Hi. How can I help you out? She goes, well, I'm here for the surgery. So I thought she was in a different office. I thought she was, what type of surgery? Well, the weight loss surgery that you do. I'm here for that. I go, can you excuse me for a minute? I walked out, went to my assistant. I was like, what the hell's going on? She's like, well, she asked for an appointment. But she's thin. What's going on? She asked to see you. I go, this isn't a prank, right? She goes, nah. I had just seen one of my best friends a few minutes before in my office for some other reason. I actually went outside to the parking lot to see if this guy was still there, and he was pulling a prank on me. I went back in, my assistant, she's still there? She's still there. I walk in. So how can I help you out? She goes, well, I need to lose weight. How much weight do you want to lose? I want to be like really thin. I go, you're really thin already. She goes, even more. Okay, so just from the get-go and by seeing you, you don't qualify, but I'll prove it to you, and I'll pull up your BMI. What's your height? 5'10". All right, you're tall. All right, what's your weight? So let's get you on scale. Pull up the BMI, it was 20. I mean, close to being normal weight, close to the underweight, you know? I go, and where do you see yourself at? Well, look at me. And she started to get a little antsy. Look at me. I look in the mirror, I can't see, I see my colleagues and this and that, and I told her, you know what? You really have to qualify for this. Not everybody can get it. You probably have a problem with self-image here, and I would really recommend, not because you're crazy, but I would recommend you see my psychologist, and maybe he can help you out with this. So indeed, she had a self-image problem there. But going back to the subject here is you can't do surgery just on anyone. You have to qualify. You have to have certain criteria that I, as your surgeon, will know you will get the most out of it. You will get the most benefits out of it because all this is already studied. So what is the BMI, which is body mass index? It's a equation that we get from your height and your weight. Here it is. This thing ran out. Anyway, you type it in to a calculator, it'll get you the number. She was in a 20 here, all right? Under 19 is underweight, okay? Overweight, between 30 and 35 obese, 30 to 35 to 40 severe obesity. Over 40, it's called morbid obesity. Why morbid? I know that the word morbid, I don't like the sound of it, but the thing is, the meaning of morbid means sickness. That means, not that you're sick, means that the level of obesity at that point will go hand by hand with a sickness, being diabetes, high blood pressure, sleep apnea, cholesterol, triglycerides, lower back pain, lower extremity swelling, so on and so forth. Normally, a patient that crosses this right here over 40 has some sort of problem already. As we go the other way, these problems go away or get better, okay? There are also higher end BMIs. Over 50 is called super obesity, and over 60 it's called super obesity. I know, they had a hard time getting those names out. Those are the medical terms. So easy way is, this is on my website. You can go to endobmi.com or go to my website. Just type in your feet, inches, and pounds. It'll get you that number. Any questions so far on the procedure? So what I'm going to do, I'm going to show you just a few of my patients, and then we can go over any questions that you may have on any subject. Sounds good? All right, so by the way, if you go to my website, there is a section, there's a gallery section of before and after pictures if you're interested. It is probably the widest amount of pictures on the internet on one single page regarding before and afters on this procedure by itself, all right? There's Tyler. That's Nina's son right now, the salsa dancer. That's 5 months, 100 pounds down. Yvonne, 8 months. Anthony, 100. This guy, 140 pounds in 8 months. Keisha, 100 pounds, 5 months. Now this is, I also have a whole bunch of medical professionals coming down to our center, a lot of nurses coming into our center, a lot of doctors from the U.S. coming to our center. This is a doctor that came into my office, and I personally know him, and I told him, "What's going on, doc? You want weight loss surgery? You want to get rid of those extra pounds?" He goes, "The hell with the pounds. Get rid of my diabetes." So he lost the weight. He no longer has the diabetes, goes into remission. I don't like to say the word it's cured, because diabetes is like cancer. Once you get it, you get it. But if you lose the weight, it goes into remission. Like when you get cancer and you beat cancer, that means you have to screen cancer down the road. Same goes for diabetes. It goes under remission, so it's no longer traceable in your body. So the procedure does really, really good. Now this is when you get serious about going the extra mile for your surgery, with your surgery. This is Amy, and Amy is a patient of mine from Miami, and I normally post this one because I like the before, after, and after. And the reason is she was doing really good. She wanted to lose an extra, I believe 15 pounds or 20 pounds. And she came back to me and said, how can I make this go? I want to get ripped. I want to get different aspect on my body. And in Miami, of course, it's all beaches, bikinis, and sun. So she wanted to lose a little bit extra weight, and all I told her just to lower the carb intake, lower the sugars, and she was already doing some exercise, and it made it happen for her. We've had some patients from The Biggest Loser as well, patients that have gone to the show, get their butts kicked for 8 weeks, and then get really unsustainable results. That is just crazy. It sells, it gets you to turn on the TV, but it really it's not sustainable. I mean, being with a 1,200 calorie or 1,000 calorie diet every day and getting a personal trainer to, move you around for 8 hours and scream at you for 8 hours a day, is just really not doable. Of course, it's great for the show. I mean, Betty Sue started at 261 on the show, and this is after my surgery. So she lost, on the show, she lost 70 pounds, and when I saw her 18 months after, she regained them all back. 70 pounds regained. Then this is her regained. This is a picture in my office, and that's her after surgery, sustained. Then I don't want to say the name of the NBC, but you didn't hear it from me. Wanted to hire her back to show everybody that the show really could give sustained, proven results. Huh? So anyway, this is David Scott. This is Sean William Scott's brother, the actor. You've seen him in American Pie. Stifler, right? Stifler's mom, Stifler. And also in Dukes of Hazzard. And anyway, David, really good guy, really good hearted guy. And he came to me, sent by his psychologist because of major depression, because he would compare always to Big Brother, right? Big Brother was the movie star, he was a hottie, he was the guy with the famous guy, the guy with the girls, so on and so forth. And he said like this, and I'm, doctor, just a simple golf instructor. Nothing simple about that. I mean, I can't hit a ball. So I told David, no, that's not a problem. We got him going, and that's his after. Now he actually came out in a movie with his brother. I think it was shot in Canada, that movie. So how about you? When to take the step? Life is short. You want to live longer? It is a good option for you. Now the Mexico thing. You're kidding me? You want me to go to Mexico? They're going to kill me down there. Steal my organs and kidneys and sell them in the black market. I got it once. One patient said, "Doctor, I just want to wake up with all my organs. I want both my kidneys." I go, "Yeah, unfortunately, those tiny incisions, I can't get a kidney out, so I'll just leave them in there." But yeah, this is a big stigma we deal with. This is a big deal, not just for me. I mean, I'm just there for you guys. Whoever wants to take the step, I'm there. This is a big issue for you guys when you decide to take the step and say, "You know what, mom or dad or husband or spouse, I'm going to Mexico to do this procedure." You say, "What? Where?" Crazy. Yeah. And once you cross that bridge, the border, they're going to shoot you to death. They're going to held you ransom, whatever. I'm going to expecting a call from, nah. The truth is, we've been doing this procedure and focused on medical tourism for over 12 years. We've never, ever had an issue, ever. Safety-wise, never. Truth, there is a way we handle it that we make it safe. Door-to-door service, we have our own vans, we have drivers available, we take you to hotels, restaurants. Nowadays, my patients go Family members get the kick out of it. I mean, family members, who's been there recently? Like, what'd you do?
Where do you want to go? Your driver takes you wherever.
You want to go to the market? Go. You want to go, I want to,
Who is it? Your cousin that owns a Mexican restaurant?
you went to the restaurant, to Casa Senador? Yeah.
You want me to do this?
That was good. But yeah, so the deal is,
Mexico. I mean, the guard at the checkpoint knew Rosa by name. I mean, until, they opened up the door to M16, and Rosa's like, don't say a word till you get the door shut.
uh,
And
Yeah.
that was great. I had a totally different perspective of Mexico.
yeah. So it's more what the media wants you to see. Media, of course, they want to sell, and they'll sell you the drug lords and the cartels and all this stuff. The truth is, I live there personally, my family lives there. We've never had an issue, and it's very safe. But it's a different aspect, different image patients get once they get there. Yes, sir.
You talked a little bit about your staff, but I think anybody that's considering going, you're the man, you're the one that does the surgery, but your staff is awesome.
Yes, thank you. Thank you. Yes, indeed. I appreciate the comment, because without my staff, I'm no one. No one. A year and a half to start hiring all these people is because I want you, once you get there, to feel as if you were here, because it's for you. So it's a big deal when you start talking about Mexico to your family members. But the truth is, we try to reduce that gap to make it easier for you to take this step. So I want to show you a short video that, where's Fabian? Say hello, Fabian. Fabian is the magician on this video, one of the guys that helps me out with the marketing stuff. And he actually did this video for you. State-of-the-art operating rooms. Everything hangs from the ceiling. We can move anything around the patient depending on our needs. Just 8 blocks from the US border. I actually use my bicycle to get there sometimes. That's the hospital floor. That's the nurse station right there. We have 10 suites. Big rooms. So you'll see them in a few minutes. That's one of them. 5 on one side, 5 on the other. And we have a special room. I don't know if it comes out there, but we have a special room when husband and wife want to get surgery, or mom and daughter, and it has 2 beds. And we get to use that room at least once a week when those cases come up. That's it. That's the room right there. Very common. I wanted to do the surgery with my daughter. Go ahead. That's the new part that we just finished last week. That's our hotel. That's the 4th floor right there. We got different types of accommodations. We've got king beds, double queens, and depending on the needs. If a patient comes by himself, herself, that's the lobby right there from the 4th floor. So, you want to know a little bit more about what we do, gastricsleeveinformation.com, and all you have to do is just fill out the questionnaire there, and my staff will be contacting you. regarding more information about my practice. Some questions that you'll be able to answer with the information we send you out. How much pain? How much does it cost? Complications, long-term effects that we talked about. And if you got any of these social media networks, we're on all of them. My books on Amazon. And if you haven't seen my show on YouTube, it's a weekly show we transmit in 2 languages, English and Spanish. It's called the AskDrA Show. And it's a show we've done for over 56 episodes. Every single week for the last year or so. Actually 2 years, 3 years now. And every single week we throw out content answering your questions. So any questions that you may have, just use the hashtag AskDrA on any social media platform. These guys will grab that information. And whenever I sit on that desk, it's like, hit me with the questions. And we record them and answer them for our patients around the world, because it's got quite popular around the world now. We get a lot of questions, of course, from the US, a lot from Canada, some from Latin America, but now we're getting a lot of questions coming in from Europe as well, and Middle East as well. So it's fun, because I know if I answer a question that you may have a doubt, it'll help a lot more online, and we have them labeled on a playlist on YouTube as well. And of course, you can also send me questions directly. As I mentioned a few minutes ago, I am the one managing my personal Instagram, and that is always available to you. It's really cool because it's gotten to a point that we've done video calls, we've done from patients from abroad, we've done really quick questions back and forth through my Instagram, and a lot more. And of course, you get to see the behind the scenes on the highlights, on the stories I post on Instagram on this procedure that we do. All right, questions? Come on, guys, it's questions. I mean, I'm good, but I'm not that good. Huh?
How long after surgery should you wait to start working out or going to the gym? Cardio, that type thing.
All right, so to start working out, you can really start walking 10, 15 days out from surgery. The thing is, the weight restriction, not lifting more than 30 pounds the first 30 days, that's not a problem. But cardio, like getting on an elliptical machine, a treadmill, 15 days out is more than enough. You can start working out by then. Submerging underwater, though. Submerging in the water is important to know. Some people like swimming. So it's a no-no prior to 15 days out.
If we're preparing for surgery, what is our pre-op before we get to Mexico? What do we have to do to get there?
Pardon me again?
What kind of pre-op procedures do we have to have before we, or as we prepare for surgery?
Okay, so good question. What do I have to do back home, if at all, to get the surgery? So we have everything in-house. That day, we do lab work, chest x-ray, EKG, and whatever needs to be done. It's all included in the price. You don't pay a penny extra. Pay it, and we deal with everything else. Transportation, door-to-door services, labs, extra labs, whatever needs to be done. Fees, doctor's fees, everything. So every individual case is different, and that's why I personally screen every single health history that comes in. So depending on your needs, and depending on your medical history, if I need anything particular from you, I'll let you know. Including, I'll give you the most common things. Patient with a previous heart attack or a previous stent placed in the heart, arteries, I'll ask for a stress test of the EKG and everything. That I'll show to my cardiologist and to my anesthesiologist. They'll give me the good to go, and patient can come down. But if it's not your case, it's very, very particular. You know, if you haven't had any major issues, a vast majority of the patients won't need anything in particular. We do everything down here. But yeah, sometimes we ask patients to do stress test, EKG, upper endoscopy if needed. I mean, depends on the case. But normally, no.
You have a vitamin recommendation for right after surgery, but let's say a year or 2 years out, is there vitamins that you recommend?
Yes. Here goes. We are working with this company right now that I'm not going to give you an answer right now, all right? Because the reason, let me tell you why. Because they are working directly with us to come up with my needs for my patients. It's not going to be a bariatric company. It's going to be like a regular vitamin company that's going to have a premium line. That premium is for weight loss surgery patients with my recommendations.
What's the timing for that?
A couple of months. Right now, what I recommend is a multivitamin is more than enough for women taking some iron, some calcium. B12, I take B12, I like it. Good energy, boosts your immune system as well, helps it. But you can do that for now, a couple of months out, and then I'll give you the complete formula. It's like, this is for my patients, you know.
Regardless of age?
Yeah, and that line will have, depending on the ages, like teenage, older scenarios, I mean, over 60, 65, medium range, you know, and people, they'll have a line of iron as well, calcium. But right now, what you need to look out for is, I would take, for you, a lady, I would take calcium, I would take some iron, a multivitamin, and B12.
No D?
Depends on your sun exposure. If it's not much, and you're just from home to an office, D3 is good. But if you get some sunlight, maybe 10 minutes a day, that's good. Good question. Very good question. Yep. Yep. So when you come for surgery, your family member is allowed to be with you 24/7, except in the operating room and recovery. Other than that, they're always there with you. And of course, we take care of them, right? Oh, no, you should see.
He's got a restaurant downstairs, and she personally cooks your food.
Yes.
And everything's phenomenal.
Yeah, we have a cafeteria downstairs, and we have a cook there, and cooks whatever you want at the moment. So we don't have it like already cooked and just heat it up. No. So in the morning they serve from breakfast tacos, eggs, omelets, stuff like that. At noon they have for lunch they've got several plates as well, steaks and dinner as well. And then we have a personal concierge that comes, says hello the first day you arrive. His name is Roman, and Roman is he's in charge of our customer service. So he'll look out for the family member. His deal is looking out for customer service, family member. You want to get a bite to eat. You want to get out of the hospital for a while. We'll take you. We have a driver. We'll take you over to a restaurant, local restaurant, or you want something in particular. Well, I want this type of food. Well, I'll take you to this restaurant, and he will be with you. Yeah, won't leave you at all. He's always there with you. Yeah, so we have vans with our logos around the city. Then we have vans going back and forth to San Antonio every single day, dropping off patients, bringing patients back. Mm-hmm. Yeah, bumpy. Yeah, we got a bumpy road. Yeah, yeah. From Eagle Pass to San Antonio, there's about 15 miles. That's like bumpy.
My name is Tammy, and I am having surgery November the 20th, and I'm going down by myself, but thankful for your Facebook page. I've met some ladies that are having the surgery the same day with me.
Nice.
So I'm excited about that. My question is, the surgery is on Tuesday, and we'll leave out like on Friday.
Correct.
Will I be able to start my job back on Monday to
Yes.
go back to work?
No problem. Tammy,
Awesome.
piece of cake. No problem.
Okay, good deal.
Yeah.
I teach, but I also do commercial cleaning at night, so I didn't know if I could do that as well.
Yeah,
So,
no problem.
All right, sounds good.
Yeah,
Thank you.
indeed. Looking forward to seeing you, Tammy.
Thank you.
Very soon, yeah, next month. Yes, but it's a good question. So it's normally get back to work. It's 3 to 5 days normally, depending on the type of job. But I've got some men that work in the oil field. That's rough, specifically in summer. I mean, they need to drink gallons and gallons of water, and that's a challenge for them. But we make it happen. We work around them. Mhm. Yes.
I love your passion about what you do, but it's important to step away and not get burnt out. Just curious what you do to get away, like you have hobbies and stuff like that, you know, or are you one of the workaholics at work 365?
You know, let me tell you a little bit about, you see me on my Instagram, right? And that's where you get this from. It's because my marketing team, I'm very passionate, and you probably see now, I work with them. I got my CEO office on the top part of the building, 4th floor, with a nice view and everything. I'm hardly there. I'm always with these guys down there and trying to come up with stuff like that. And my personal Instagram page has gotten a lot of traction from 12, 13-year-olds, 16-year-olds, early 20s, on the hustle side, you know? On the hustle. It's like, I want to be like you, Dr. A. You inspire me, you know. I want to do something with my life, the hustle, the work life, all this. And the guy that runs my marketing came up to me and said, you should separate your personal account, and you can run it as a motivational way, as business-wise, more than weight loss, you know? So what I try to do is give out a tip that will apply to both things, you know? Stay focused, determined with your goals. If I say that, it will apply to weight loss and can apply to life itself. So that's what I try to do. But yes, I work my ass off. My team knows it's my passion. For me, it's not a work. You mentioned it yourself. I mean, it is a passion. For me, it's not a work. It's not a job. I love what I do. I love coming up with new stuff for my patients, doing more. And I mean, this new hospital, I mean, I could have stayed at the former hospital. The experience was good. I mean, you're there for surgery. It was good. But I spend every single dime into this new building, and plus more, plus more into this, and I'm back to square one, you know. But it doesn't matter, because this is for you. It's for my patients. It's for a great outcome. It's for safety reasons. It's for all. It has a win-win-win-win thing, you know. Back to your question is, do I have a hobby? Yeah. I like to exercise. You've seen it in the morning. That's my time. I wasn't like that before. You probably think, well, he goes to exercise and that's his time off. You know, his recreational time. No, it's gotten to that point. You know, I sometimes post it in the morning when I wake up. I tell Alexa what time to wake me up in the morning, and you see that as well. And it's motivational. The reason I do this is for my patients to see that I'm just like you guys. I mean, if I set my alarm at 5 o'clock in the morning, 5:10 or 5:15, it will be a struggle for me to wake up like any other person. But I got to do it for me, for my loved ones, for my team, because I am on this big ship that I have 80 employees behind me on this journey, and I am the leader, and I have to be good for them, because if I'm not good for them, trouble's going to happen. So I take care of myself. You see the vitamins that we were mentioning a few minutes ago. I sometimes post my vitamins. And the reason I do this is to show you. I mean, even though I haven't had weight loss surgery, I struggle with weight. I did my mom's surgery. I did my cousin's surgery, my other cousin, my aunt. I mean, obesity runs in my family, and I struggle like any other person every day, and I work at it every day. And that's why I try to transmit and show. I used to cycle a lot. Now we're getting colder weather, so I normally from November to February I'm off my bike. It's a good time to meditate. I like it a lot to get my mind cleared up. Now I meditate. You've probably seen it as well on my Instagram. I meditate. It was a practice I would see some others do, and I would think of them like, cuckoo stuff, man. It's just, they're wasting their time. But listen, it works really good. It works really good. All you do is, the truth about meditating is you're pausing your day to analyze what's going on. Because if you analyze your day, everybody's rushing. You got to do this, rushing, jumping into the shower, get your clothes on, out the door, grabbing something to eat, working, back you go. Now I got to go pick my son up. Now I got to go do this, run errands, go back. And you're back in bed. You did not stop at all the whole day to say, pause, what's going on? You're like, I sometimes feel like I'm a hamster in a wheel. Another day went by. Another one, you know? So meditation has helped me a lot to pause, clear my mind, see my objectives, and not just be running around like crazy. Is this going to help me? No. I need to focus on my objective today. This is the rest I clear out. So meditation has helped me a lot. My morning routine helps me a lot because I start lifting weights. At the end of my session, I do 10, 15 minutes of any type of cardio. Those 10, 15 minutes, I mean, they help me a lot. I'm with my phone there, and just ideas start coming at me, and I start adding them to my notes, you know, it's like this and that. When I get to the office at 9, I mean, I'm on fire. I'm on fire. By the time these guys are waking up, like, morning, Dr. A, is like, hey, I need this and this and this and this and this and this, and what's this, how's this going on, how's this project going on, you know? But it helps me a lot. So meditation, exercise, yeah, definitely. Any other hobby? Do I have any other hobby that you can think of? No? No, that's it.
This is for the ones that are contemplating on the surgery. You have nothing to worry about. His nurses are sweethearts. They really are. I had a friend of mine that decided not to go to Mexico here a while back. It's been about 5 months ago. Went locally and has had a terrible experience. I had an awesome experience. No pain. When they got through with me, there was no pain. The only pain I had, the most pain I had, was the little bit bigger incision. And that my stomach didn't hurt. It's amazing. They do an awesome job. You have nothing to worry about.
Thank you so much. Thank you. Now let me tell you a little bit about, now that you mention, I'm not worried about, I'm just one guy that runs this ship. I can't do everybody's surgery around the States, coast to coast. And my intention is actually to help out whoever wants a safety experience, safe, secure, and good outcome, and at a fraction of the cost in the States. That's my goal. I do not compete with Tijuana's prices in Mexico, which is crazy, all right? So blows my mind how these guys, I mean, you want a cheap surgery, I can tell you right now, $4,000 in Tijuana will get you a sleeve or something similar. I don't know.
And no kidney.
And no kidney. The thing is, here goes. I'll give you the numbers. I mean, there's nothing to hide. My expenses, my numbers for a regular sleeve run between $3,500 and $4,000. That's my cost. The rest of the money I have to split out for the hospital, the staff, doctors, so on and so forth. So how can they offer you a sleeve for $4,000 where it's my cost and I get wholesale prices because I am one of the leading gastric sleeve surgeons in Mexico. I work directly with Johnson & Johnson and Medtronic, directly to them, Johnson & Johnson Mexico, which is Johnson & Johnson the States, and get all the material that is used to craft a sleeve in New York City at our center. Same thing. My price, $4,000. Their price, $4,000. That's just my cost. So what can you expect? What type of material is being used in you? What type of disposable, if they're doing disposable material, is being used in you? I mean, it just doesn't add up. I don't know what they're doing, you know? But that is the best price I can get directly from Johnson & Johnson in Mexico. We use the best of the best technology, latest. Last year, Johnson & Johnson came up with brand new, they call it like third generation staples for doing the sleeves and everything. They are amazing. They came out for the regular public surgeons this year. We were using them last year already. So premium, top-notch material, totally disposable material. Use it, throw it away to the trash can. I even have one person breaking the material intentionally. So if someone gets a hold of that material that we just disposed of and they want to re-sterilize it, they want to reuse it in some, I mean, I'm crazy, I'm sorry, I'm OCD. But I tell my nurses, I have one nurse in the operating room, is like, that stapler I just used on this case, break it, then throw it away. Not usable, you know? So if somebody goes, looks into my garbage, they won't be able to use it. So I'm that OCD, because I totally believe that safety is number one. I mean, you can bargain for or look for a better price on some jeans or a shirt or a suit. Hell, I don't care, but not with your health. I mean, life is very short. You want to live it good, live it to the fullest, and we want the least amount of complications. Yes, sir.
Mentioned earlier that people want to go, but they're a little apprehensive. And my wife got ready to go about a year ago. I was also. But I was so impressed from the time that she got ready to decide to have this thing. Not one moment was I ever scared. I was not frightened. I was not, and I'd never seen an organization from the point A here until you return to point A here run so efficiently.
Thank you. Thank you. Thank you. Tess.
Speaking about safety and just reassurance, you know, I had my surgery quite a while back, but when I got back from last year's reunion, my 13-year-old daughter asked me about it. 13 years old is pretty young. She was pre-diabetic. For 3 years, we've been going to Arkansas Children's Hospital, kind of dealing with that, trying to help her exercise. She would get injured. So she had her surgery in January, and if you know, I know some people are concerned about going to Mexico or, you know, the fear of something going wrong, but the child's life has changed tremendously. I mean, she's outgoing. I mean, she's standing out there waiting for me to go shoe shopping. right now. But, she's just a happy child, and I know that we don't put a lot of that on social media or like obesity help. We would like to write a review for that, but it's kind of scary because she is young and there are child predators and things like that. So, sometimes that's not the best place to put it. But I would suggest, because there isn't a platform to really talk about it yet, but I think there's some good that can come out of recognizing the need for surgery at an earlier age instead of waiting for her to be 18. Because she does struggle with identity, kids and teenagers do. And I just wanted to say thank you for doing that for her.
My
and
pleasure.
for changing both of our lives. We're both happier and healthier because of it.
Pleasure, and knowing your whole family and being there for you guys. It's an honor. Yes, thank you. We see it more and more now that teenagers are coming up with. Bullying has always existed. Since we were all kids, always. But now with cyberbullying and all this stuff and texting and teenagers really do suffer. We get it more and more. We see teenagers, at least we see one teenager every week at our center. We normally see the higher end teenagers, 18, 19, 16, But yes, we do see the lower end. We see 13, we see 12, we see 14-year-olds coming into our center. And indeed, as Tess mentioned, patients, the family struggles. It's a big struggle because everybody's going against the grain here with the teenager, trying to get them focused, trying to do this, incorporate them in a certain program. Teenagers are like, nah, Mom, you don't know what you're saying. It's my life, and it's a struggle. But once the teenager comes around, knows about this, we work with them, their life changes in so many good ways. Adults as well, but the teenagers, the psychological aspect's just amazing. I had a question here. Yeah.
Not really a question, but just a comment. I've had a lot of people ask me, well, what about follow-up? Once you get home, if you have a problem or you have a question, you're so far away. Well, of course, when I got home, I had several questions, and all were answered very quickly, either through an email or a text. But speaking as a healthcare provider, I've had quite a few of my patients go in the States around our local area and have had a few come in to my clinic with problems from their surgery afterwards, and trying to get their surgeon to call me back was like pulling nails. I literally said, you're gonna have to call him. I need to talk to somebody. She's losing weight. She's sick. She can't keep her food down. Just the comparison between what y'all do and your follow-up when I've ever had a question compared to what I see in the States, I tell my patients that all the time. Your follow-up and the support that y'all give afterwards is tremendous compared to what I see my patients are getting with going with some of the surgeons in the States where I'm from.
Thank you.
So,
We try very hard. My patients go home, every single one of them go home with my direct email, bypasses everybody, comes directly to my phone, but it's right there. And goes to my phone. Everybody knows Susan. Susan's behind the desk, practically 24/7. We can practically get to a question within minutes, always. Now with social media and other platforms like my Instagram account, they go directly to me, and I attack those questions directly there. And of course, you got my phone number directly. So what we try to do is transparency. We try to avoid all these steps to get to the surgeon, like if I was a holy God or something. It's simple to be there for you guys, because all you have to do is put yourself in the shoes of that patient, and if he or she needs now your attention and your help and your advice, you got to be there for them. So it's important to be there for the patients. 5 minutes once they walk out the door, 5 years, or even 10, right, Ray? There's Brandy. Well, that's this blonde girl right here is probably the main reason we're here in Memphis. I mean, Northeast Arkansas has blown up due to Brandy and her help and her assistance and her support groups that have been growing and growing like yeast. It's just crazy, you know. So you've been doing a great job, Brandy. Thank you for being there for all the people and the support you've given them. So that is probably the main reason we're here. So it's a great group every month, right? Every month. Brandy, we were having dinner last night, and Brandy was saying, it's a dream. We'll probably end up having a building in Northeast Arkansas just for our patients. We have so many patients from this area. Yes. Yes. Yeah. And practitioner. So, hell, we can put up a center right now. You had a question?
Yeah. So can you talk a little bit about like preventing regain or, what are the myths about the sleeve stretching back out, things like that?
About regain?
Yeah.
And
like your sleeve stretching back out and the myths of that.
Gotcha. Whew, boy. All right, here goes. So I was in a panel in Dubai a few weeks ago, and it got kind of steamy because we were talking about weight regain in patients. And I'll tell you this, absolutely every patient has weight regain, everybody. But it's normal and it's expected, all right? The thing is, patients are freaking out, right? Once they hit a desired goal weight or even under that, then they're thrilled, right? The thing is, if this is your final result, then you're way up here and your weight loss is coming this way. This is your end result. Your weight loss normally comes past it, hits rock bottom, and then stabilizes to your end result. That, from here to here, that weight regain causes a lot of mental issues in patients thinking, oh my God, I'm going back to where I was. It won't happen. It won't happen. You have to put your mind to it to beat the procedure. You can beat it. I mean, no procedure is guaranteed to get you to a desired goal weight and maintain you there forever and ever, because there is a lot of stuff that depends on you, you know. So now the sleeve stretching, the most important or the most stretchy part of the stomach that we remove is that part that's extracted. The part that stays behind is the part of the sleeve that has the least expansion, sort of way. And the thing is, patients compare, as I mentioned a few minutes ago, compare their initial restriction a few weeks or a few months out from surgery to the restriction they feel a year or a year and a half out after their procedure. It's totally different. The truth is, after 6 to 8 months or a year out, that is the true restriction. It doesn't mean it stretched out, you know. So there's only a certain percentage of stretching out that goes on, really. And that is between a 3 to 5% in a 5-year period of time. So it really is minimum. So the size it was left, it'll stay that way for the next 5 years. It'll have a minimum amount of stretching out. Unless the procedure was carried out with a novice surgeon, where they leave certain areas that are certain pitfalls, which are important. Does that help?
Yeah.
Yeah, perfect. That was a good question.
Is there any drain tubes that will be there after the surgery?
No, I don't use drain tubes. 99.9% of my cases, I don't use drains. I don't like them. I used them. I don't like them because they're misleading. All right. I'll give you the best example. If I leave a drain tube after surgery, by the way, before I go into that, let me tell you, we do perform 2 leak tests in the operating room. So we make sure that sleeve is airtight sealed. We do a leak test with air, make sure nothing bubbles out. Then we do a leak test with a blue dye. All right, so we do a leak test with water and the other one with air. That sleeve is sealed. So that gives me a lot of confidence in not leaving a drain. Doesn't make you leak proof, because if you don't follow the guidelines and you're trying to eat a quarter pounder once you go out from the building, I mean, you're looking for trouble. But here, so to answer your question, if you leave a drain, that drain covers a certain area of your abdominal cavity only. All right, but the sleeve is tricky. If you leave it at a certain quadrant or a certain area, and for the surgeon or novice surgeon, he or she may think it will give him peace of mind because it has a drain. The sleeve it may be 24, 30 centimeters long. There's no drain that will cover absolutely all the aspects. It's better to go with clinical symptoms and signs and certain things we detect right away. And that is the reason I keep my patients 2 nights. Okay. All right, so that's a critical point. Once they cross that, I feel comfortable for them to take off. Even though the second night, patients are like, they're kind of like bored, you know, it's like, oh, another night here. But I prefer that. You go home good in one piece. Because if it starts leaking, you have a drain, and that drain is not picking up that leak, you're going to be in trouble. And as a surgeon, you'll say, well, I placed the drain, nothing's coming out. And patients start getting worse and worse and worse. That is why I don't use them. They're misleading. So my patients don't get urinary catheters or a drain. Urinary catheters because anybody can last 25 minutes without peeing. So that's why. Mm-hmm. Goes into remission, yeah. If you go to your doctor and you show them those numbers, if you come to me, I've never met you before, show me those numbers, I'll tell you you're not a diabetic patient.
Well, I asked him just recently, I said, does that mean my diabetes has gone away? And he said no.
Yeah.
I'll always be diabetic, but I've been off all meds. I don't take any meds.
It's under remission. We call it it's under remission. Yeah. No trace of it. Like when you're cancer-free, you used to have it. But right now, there's no traces of it. It doesn't mean it can't come back. So, of course. The way it should be. But I talked to a gentleman earlier today. He's diabetic. He's got some neuropathy, some damage already. The nerves, that's damage, unreversible. The nerve damage is unreversible. That's done. What you can do is, as I was explaining to him, if he gets the surgery, his diabetes will get under control, and he will actually stop damage down the road. That's the best Yeah, definitely. All right. Well, thanks so much for being here, everyone.